Obesity is a health issue that is plaguing our country. In fact, 2 out of every 3 adults in the United States are either obese or overweight. There are many complications from obesity, including diabetes, cardiovascular diseases, certain types of cancer.
We're killing the next generation of Texans and Americans by our lifestyles. Treatment of chronic diseases and diabetes is not the answer. In fact, that's part of the problem. We're putting all of our resources into high-cost, physician-centered treatment for folks who already have the disease. What we began to emphasize then was prevention and control. And we really focused on diabetes because if you can prevent and control diabetes, you're preventing and controlling almost all the chronic diseases.
So there are communities in the state of Texas addressing obesity and diabetes. And in fact, in Webb County, Nueces County, Galveston County, and Cameron County, there are people who have come together in a comprehensive and strategic way to address obesity and diabetes.
Community-based prevention and control means actually understanding the environment of that community. The basis of the program is to go into these counties and really looking to local leadership. And so we started training community health workers, men and women recruited from the community who knew the community, were accepted and trusted by their neighbors to be the front line.
It's the pivotal component of our whole project because we started with home visits, and I think that is the way you enter people's lives. They are a catalyst of positive change in the local community because they know the language, they know the people.
When we go to their houses and start telling them you need to increase your vegetables and increase your fruits and exercise so you can be more healthy, they look at us like a role model.
It's like a backup. It's the second team. It's a real friend going to the home, but very professional. They know exactly what they're doing.
It's those promotoras that get down to the grassroots level, that get down and find out exactly why they're not being able to control their blood sugars, why they have not been able to make sustainable lifestyle changes. And that is what's so important of the Promotora project.
And so not only do we have that resource now we have something to feed it into. So now we can work with the community health workers to develop programs, to develop classes, to form that network.
After a few months, she kept coming, bringing us information about taking care of our health. If the promotora comes to the community and brings the information right to your house, you're gonna take notice.
So I think it's proven that promotoras have a good role in the community, are the mediators, and we definitely have the information that patients need.
It's not enough to educate somebody that they should make a change. How can they immediately act on it? So then we started having our community health workers immediately translating that counsel and education into action.
We focus on the nutrition part, and we teach the clients how to make better choices at the grocery store. Our clients also have a community garden where they grow fresh farm fruits and vegetables.
A lot of our students, they do come from low socioeconomic places, and what happens is they can go home and tell the parents, you know, it's good for you to eat carrots, but if they don't have the money to go purchase the carrots, then we're not accomplishing anything. The kids are now not only learning the academic part of it, but they're also doing the application, which is leading to more success.
My husband, he is diabetic, and when I make this change to eat more healthy, I notice the change in him is a big change.
One of the things we emphasize is not just the role of nutrition, but the role of exercise in their lives, so that we're coming together to act as a community to face a problem that no one is going to solve on their own.
We have seen no one in the family getting physical activity and started it with mom and then introducing kids. And now mom, dad, and kids are walking on the park, for example, in the afternoons.
We have now more parent participation, that maybe parents didn't know our facilities were here. We've been here for a little over a year.
We've seen a lot of people lose weight in our aerobics, and we've had several people that were really depressed, but when they came, they lost 15 to 20 pounds, and they felt better. Their spirit was a whole lot better.
I hope that this program can continue in the future and possibly grow.
This has been a big benefit and a big help for my health. I'm thankful for this program. It's motivation for my family, for my children. Little by little, our family has made changes. I believe we've seen the benefits. First in my mom's health, and then in the rest of our family. I started going to exercise at the parish hall. But when I stopped taking the cholesterol pills, I had a massive infarction. I could have died. But because of the exercise, I never lost consciousness or my ability to speak or move. The nurses, they called me the exercise lady. And so for me, this program has been a blessing.
We've got to focus on physical activity. We have to focus on healthy foods, fruits and vegetables, portion control. If communities and individuals can move to that kind of focus, we'll see much better control of diabetes and obesity.
The best way for community leaders and community partners to affect consistent, sustainable change in your community is to partner together.
There's always leaders in the community. You have to find them, and you have to gain their trust, because then they, in relation, transfer that trust to the people they know.
I began to see my role in this, being a leader, being a role model, that I had significant impact on people. I used to weigh 220 pounds. I lost 80 pounds through nutrition, through healthier choices. At first I thought, well, I did it just to be healthy, but then I realized it was my responsibility to bring that message to my parishioners, that they too can have a healthier lifestyle. They too can make healthier choices.
To be able to have a buy-in from county officials, city officials, it's important that you show them the benefit of what you are doing.
We do surveys with the local community. We do focus groups.
Having programs that can evaluate return on investment, whether it be on an economic basis or a health basis, that feedback and follow-up and ability to evaluate the effects of what you voted on as a public official is crucial.
We knew early on, absolutely critical to work with our lawmakers and policymakers.
If you want people to be healthier in their food choices and their motion and activity in their daily life, then you have to, as a public official, make sure that your policies reflect the ability to create those spaces. Creating changes in the built environment so that there are parks, and not just that there are parks, but that parks are accessible.
We work with the County Parks and Recreation to put in a safe, secure, lit walking trail. We helped the local nonprofit to establish the community center and have aerobics classes in it.
We have seen some amazing efforts. We have exercise classes in some of our churches, cooking classes down in one of the rural colonia areas of Nueces County. We really have rallied together, and we're all working for the same purpose, and that is really to make a better community.
I've been able to appear on television and give my testimony. I've been able to appear in their newsletter to give my story of freedom from food addictions and losing my weight.
And I think it's very important to share with these people what I need to do to improve our health.
The University of Texas Community Outreach Program is so vital to our county and any county that could put these kind of efforts into place.
This program definitely has impacted the community as a whole, because you can come over here and be informed and get some classes.
Well, it changed my life, like my eating habits, and I exercise more. It helped me control my diabetes. I'm very happy.
Is having a completely unifying effect on the community. People are coming together.
So the three of us plus our parents have made some changes. I feel really happy that all our family, 3 generations, have made changes.
Yo me he sentido muy bien.
I felt really good. I've benefited a lot from it.
Ahora camina.
Now she walks really well. Now I'm the one who can't keep up with her.
It's all centered around prevention. It's getting to people before they become diabetic, teaching them how to eat healthy and exercise and just do small changes that make big differences.
What we're trying to promote is long-term sustainable changes in the environment, focusing on the proven effective strategies for doing this work, for changing our lives. It's lifestyle changes, it's community changes.
In the end, are we going to prove the old adage, an ounce of prevention is worth a pound of cure?
Research shows that decreasing the average amount of glucose in the blood by 1% leads to significant healthcare cost savings, and that when persons with diabetes are able to maintain near normal levels, they have significantly less diabetic retinopathy, neuropathy, and nephropathy. Preliminary data from the UTCO project shows that participants are decreasing their average blood glucose levels as measured by the HbA1c test. Research shows that weight loss is the important strategy in reducing new cases of diabetes. Preliminary data from the UTCO project shows that participants are losing weight.